Okay, well, in the interest of starting on time and honoring those who are all here already and those online, my name is Dan Derksen. I'm the Associate Vice President for Health Equity Outreach and Interprofessional Activities. And I'm so excited to have this symposium happening after many months of planning for this. And I just wanted to give a very brief overview of the One Health initiative as it's starting. So welcome to all of you, and thank you again for your participation in this. Looking forward to hearing the brief presentations from those of you who are presenting today, and thank you all for responding so quickly to that request for presentations. As you all know in the audience, One Health provides a framework to simultaneously address pressing problems in human, animal, environmental health. We had over 70 faculty that either self-identified or were identified by their dean or chair that are involved or interested in One Health research. We looked back over the last 10 to 12 years, and those faculty that expressed an interest or their dean or chair told us they were interested have accounted for almost 200 million in research funding over the last 10 to 12 years, which is very impressive. Of the 70 faculty that indicated an interest, 39 attended a planning meeting on February 10th or March 30th. 10 individuals were able to attend both meetings, and they were the ones who came up with many of the ideas of how we could get this kicked off and learn from each other about the exciting research going on, and also as a catalyst to getting us working together and understanding what others are doing so that we can collaborate should we get the state appropriation that we've asked for as part of the University of Arizona ask for recurring state appropriation this session. These are the individuals who were able to attend some of the planning meetings. I want to thank them all. I see many of them here in the audience. Many more expressed an interest, but we're unable to make those given all of our busy schedules and all the things that we're doing. Of course, we'd like to see more interest, and this symposium is really to spark that, to record this, to get it out so that people know who's working on what across the university. There was several individuals on this list who indicated an interest in presenting but weren't able to be here today because we're still in the middle of final exams and teaching and things like that. So clinical duties and the like. So we did prepare some of the additional materials that will be included in follow-up to all those who indicated an interest or signed up for this. This is what it looks like as far as what would the leave behind, the one pager for legislators. And it was part of the New Economy Initiative that the university received some recurring funding last year and asked again this year. Building education, research, and workforce. The total appropriation that was asked for in recurring of the state legislature this year was 24 million. 8 million for veterinary medicine, 8 million for cooperative extension, 4 million for cancer technology, and 4 million for One Health. The University of Arizona's New Economy Initiative request will develop a skilled workforce for Arizona's agriculture and healthcare industries and enhance programs that strengthen rural economic opportunity. This is more specific to the One Health initiative. And I want to walk through this just briefly because it does kind of set the tone of what we're aiming for in our work. So establish a robust One Health initiative, which is the intersection of human health, animal health, and environmental health. The University of Arizona will leverage its medical schools, College of Agriculture and Life Sciences, College of Veterinary Medicine, and College of Public Health, amongst others, to expand the One Health certificate program for current and future health workers seeking knowledge and skills in epidemiology, the environment, disease outbreaks, and prevention in relation to protecting public health. One of the things that is very important for our state and the Southwest is analyzing environmental surveillance, such as viral and bacterial infectious disease, as we've seen over the last 2 years, as well as waterborne illness and toxins to develop solutions to assure safe and healthy food and water, and quickly translate research findings into treatment interventions and prevention. We also seek partnerships with the state and private industry to address Arizona's future healthcare environmental challenges. When we did this ask of the legislature, they asked us to estimate a return on investment. And because of the track record that we've had over the last decade in One Health related initiatives, we felt that this would allow us to compete for $50 million in new research funding from entities such as the National Institutes of Health, National Science Foundation, U.S. Department of Agriculture, Department of Defense, and private industry. These are just a small subset of those grant funders that are currently funding research in One Health related activities at the University of Arizona. This is an image that I think speaks well about how One Health brings together human health, the individual, family, community health and well-being, environmental health, clean air and water, agriculture, recreation, parks, and wilderness. In Arizona, as you've probably been seeing in the television, radio, other media, water is a huge issue in our state. And it's important to all these other sectors as well. And then animal health with the new veterinary medicine, education component, healthy pets, ranching, wildlife, safe foods, disease, and injury prevention. So we leverage our top University of Arizona research, education, and clinical programs to identify, develop, and implement practical solutions to improve health outcomes, assure safe and healthy food and water, and quickly translate research findings into business, medical, technological, and treatment benefits. And I took this with my iPhone in Washington, D.C. at the new Collaboration Center on Pennsylvania Avenue. We took a subset of key state legislators to D.C. to talk about some of these initiatives. And Frank Von Hippel did a very nice job of presenting on One Health in a very brief format, and you'll be hearing from him next. One of the images that we're trying to develop is really some of the challenges we have. This is true not only for Arizona, but also into New Mexico, and then sharing our border with Mexico. Some of these issues of areas with high uranium, with high arsenic, with perchlorate, and how that tends to get into the water supply and affect the things that we eat and the work that we do. So we really are trying to emphasize this and translate it to a legislative level so that they can help us catalyze this type of research and develop these new interventions that can prevent some of the collateral damage that happens when we don't take care of our environment, human and animal health. So with that, I'm going to introduce the individual, faculty member who's going to facilitate the rest of the morning, Frank Von Hippel. He's a professor of environmental health sciences at the Melanie Zuckerman College of Public Health. He's born and raised in Alaska. He received his AB at Dartmouth in biology in 1989, his PhD at the University of California, Berkeley in integrated biology in 1996. He's been teaching for a long time at Columbia University, University of Alaska at Anchorage, and Northern Arizona University before we were able to lure him here in 2021, and he's already hit the ground running. He's taught ecology field courses in more than 20 countries and conducted research at the nexus of ecotoxicology, mechanisms of toxicity and health disparities, with a focus on indigenous and underserved communities in the Americas, Africa, and Australia. His research is very widely covered in both the scientific literature, but also where a lot of Americans get their information from the public media, including the New York Times, NPR, The Economist, BBC, and many others. He authored The Chemical Age, University of Chicago Press in 2020. And for more information, please visit his website. He has a wealth of information on there. And with that, Frank?